Please take it away. Great.
Good morning. Thank you for your patience. Can everybody hear me okay? Okay, so I work for Integrated Services of Kalamazoo, the community mental health in Kalamazoo County. I supervise the emergency mental health team and the same day access. So we are the front door to services. We have this beautiful new building downtown at 440 West Kalamazoo Avenue. It's open 24 hours a day for crisis. And we do opening to services from 8 a.m. to 8 p.m. You can come in and get an assessment to be referred to services through community mental health. So I'm going to talk to you about those services today, what you can get, what we do down there, and I'll hopefully be able to answer any of your questions. All right. So the urgent care that at 440 West Kalamazoo Avenue.
To the back of the room to see if I can find your mic.
Okay. Is the front door to services or mental health services in Kalamazoo. So we serve anybody from childhood to adult. I'm going to talk mainly about adults because I work with adult services. Youth services, youth and children is a different deal. They have different hours, they have different services. I'm not as familiar with them, so I'm not going to try and explain that to you as much. I may be able to even tap into my wife here. She used to work in the youth department there, but in any event, we take any kind of insurance. We used to only take Medicaid or Medicare or uninsured folks, but last year we became a certified community behavioral health clinic, which means that we can take any insurance from any like commercial insurance. We can take from any state. It doesn't matter where you live. It used to be that you had to live in Kalamazoo County to be able to access services through ISK, but now you can live in any county. So the urgent care downtown provides specialized help. So it's for non-medical behavioral health. We don't have any psychiatrists there, but if you're in crisis or somebody you know is in crisis and wants to come down and they're having, which I'll get into here, things like suicidal thoughts, or if they're having, depression, anxiety, acute grief, I'll let you read this stuff here, but we don't have a psychiatrist on staff, so this is for somebody to come in and kind of de-escalate what's going on and kind of come up with a plan for you or whoever you're with. Yes?
Can you read the rest of them? Because it's pretty small print for the folks in the back.
Oh, sure. So we handle mental health crises. So that's, and there is no definition of crisis. If you feel like you're in a mental health crisis, come down, or somebody's in a crisis, come down and we can talk through that with you. Suicidal thoughts, depression, anxiety, acute grief reactions, panic attacks. We can help you with to try to self-regulate. Like I said, we don't have any medication on staff. We don't have any psychiatrists that can help, but we can at least come up with a plan. And if you end up needing, or your person who comes in needs to go to the hospital, then we can coordinate that through there. We have a bay and everything that ambulances can come into. And we also handle problems with substance use. So if you have somebody, or you or yourself is having problems with substance use, you don't know where to start, we have recovery coaches there, which I can talk about right now. So at the bottom here, we have recovery coaching. These are all people who are in recovery, and they are on call 24 hours a day. That team actually also goes to hospitals and ERs. If somebody in the ER is like there with an overdose or wanting to get into substance use treatment, they will go out, but they will also come to the urgent care 24 hours a day, meet with you, come up with a plan. They might help to determine, if it's during business hours, they'll help you call Southwest Michigan Behavioral Health, who authorizes substance use treatment. And now that is only for Medicaid in Kalamazoo, but they will also help to figure out resources for you if you have another insurance plan. So they can call your insurance company with you, they can advocate with you, they can provide information about groups that you can meet with and what have you. We also have community health workers. I'll start up here now. And these folks they specialize in knowing what resources are available in Kalamazoo. So not only for mental health, they help people apply for Medicaid if they're uninsured. They can direct them and assist in helping them apply for health insurance on the, what the heck's it called? The marketplace. They can link with food assistance and things like that. So they're really well versed in community resources, and they can help in those aspects. And sometimes, we have one that's dedicated to the emergency mental health team, my team. So if somebody's in crisis, she has gone to Loaves and Fishes and brought food to people and things like that, if that's something that needs to happen. And we also have community health workers that just work specifically at the urgent care that's not part of the emergency mental health team. And if it's determined that you might need some longer term assistance with something, they can work with you for like up to 30 days, I think it is. So it's kind of like a mini case management. And I'll talk about case management here in a little bit. And then we also have our mobile integrated behavioral health team. They can help people with housing resources. That team is not only stationed at our building, but also at Ministry with Community, which is the drop-in center for the homeless population or the unhoused population in Kalamazoo. So, and they can link with residential opportunities and HRI, Home Resources Incorporated, I think Housing Resources Incorporated. And they work closely with our housing department too. Okay. So assessments for services, you can just walk in the door. We don't take appointments. It's on a walk-in basis, Monday through Friday, like I said, from 8 to 5. Youth is a little bit shorter. It's 8 to 8, and youth is from 8 to 5. And like I said before, we accept all insurances. And if you're uninsured and you make too much to get Medicaid and you don't want to apply for insurance, we also offer a sliding fee scale for services. If anybody has any questions, just interrupt me, okay? Okay, so these are all the services that ISK offers. We have psychiatric services, therapy, DBT, and I'll get into what each of these things are. And these are listed from lowest level of care to highest level of care. So we'll start with psychiatry. So we have a psychiatry clinic that we operate. It's at 615 East Crosstown Parkway. And there we have psychiatrists, and we also have some mid-level practitioners. There are some nurse practitioners and some physician assistants that are also specialized in mental health. And that's what we have there. We do offer some video teletherapy, but you must come into see your psychiatrist or your prescriber at least once a year, and you also have to meet with the clinic coordinator and do a treatment plan once a year. We also offer outpatient therapy, so this is like a traditional outpatient therapy clinic, and this is at 2030 Portage Street on the corner of Portage and Elcott, right near Family Health Center's over there. Goodwill is over there, and it's also across the street from Los Brothers Mexican Restaurant. So we have therapists over there that range from a variety of modalities. There are some that will also see people via teletherapy. But again, you must go to your first appointment to meet with them for the first time, and then they can coordinate teletherapy for you.
And this is also walk-in?
No, for therapy, no, none of these other things are, you to get to these, you have to come and see me downtown at 440 West Kalamazoo Avenue. We also offer dialectical behavioral therapy. This is a specialized therapy specific to people with borderline personality disorder. Anybody does anybody know what borderline personality disorder is? You do? Oh yeah, you're a psychologist, right? You want to help me out?
A diagnosis, but folks that have quick overview, people that have difficulty modulating their emotional response.
Yes.
It becomes part of who they are.
Yep. That's a good, concise description. Thank you. So this is something that can't, borderline personality disorder can't be treated by medication. Yes.
Not a question, just a comment. So I just want to add on to what you're saying. DBT is excellent for people who have that diagnosis, but also it can be for chronically suicidal people or people who are self-harming. And so, like we heard in the back, it's, difficult for them to sort of regulate. So I don't want people to walk away thinking, oh, they have to have this diagnosis in order to get this service. You don't, but it's what it was designed out of. Sorry.
Thank you. So you have to at least have some criteria for a diagnosis or of borderline personality disorder, but like Paula said, oftentimes people with borderline personality disorder have the traits of borderline personality disorder without necessarily a diagnosis, which includes suicidal ideation, chronic suicidal behaviors, self-harm. A lot of folks with trauma end up in DBT. So DBT, to be a formal DBT service though, has to offer a number of things. So one of those things is 24-hour coaching. So that is like you have access to, like if you're in the DBT program and you're in crisis and you feel like you want to hurt yourself or you can't figure out how to access the skills that you've learned, you can call on 24 hours a day. You'll get a coach and they can walk you through that, because when we're in crisis, it's hard to access tools that we've learned in therapy. So that's what that's for. So you must have that. So if you see any DBT anywhere else in Kalamazoo and they say they offer DBT, if they don't offer 24-hour coaching, it's not really DBT.
So what is actually DBT? So
Dialectical behavioral therapy.
how is that different from any other therapy?
Well, it's very structured. Oftentimes it's not like your typical talk therapy. They teach you specific skills to self-regulate. So they've got all kinds of acronyms that they use, and I could spend probably 2 hours talking about that, but I'm not a DBT specialist. But that's really what it is. It's a more structured form of therapy. Now, most often people who go to therapy, you sit down with your therapist and you talk about what's going on, and you do work on some of these coping skills, but DBT is like really focused on that, focused on mindfulness and knowing when to your thoughts are being irrational and things like that. Now, again, that's very similar to some talk therapy, but it's really more focused on that. So people in DBT oftentimes will even have like DBT journals. So they will journal when they've had a situation where they needed to use a DBT skill. Gosh, that's a start.
At least a 3-day seminar.
Yeah. I mean, yeah, and it does require special training to be a DBT therapist. So that's something I'm not trained in, but it does require special training.
So would this be something a behavior therapist could do if they specialize in this?
It's kind of, but not really.
The question from the front is this the same as cognitive behavioral therapy?
It's very similar to cognitive behavioral therapy, but there's some different components to it.
It's a very specific toolbox.
Yes.
It's specific tools.
And I will add on to this, there's a lot of people in the community that say they're DBT informed therapists. And that means they've gone through the training, but they don't hold groups, because DBT holds groups, and they don't have 24-hour coaching calls. So that's sort of like the difference. There is lapover sometimes between DBT and cognitive behavioral therapy. They're similar-ish, but this is a much more structured in a different way. There's a binder that goes along with it. It is for both adults and youth. I don't know if ISK runs a youth group or not, but
Yeah, they do. And also to add on to that, it's a 1-year program. So if you're going to go into DBT, you have to commit to a year, and it meets 2 days a week. So 1 day a week you meet with your individual therapist. A second day a week you meet with your group. So, and DBT also offers, some low-level case management, which is, they might help to coordinate some other services around what's going on throughout DBT, that you might benefit from. So it's a little more intensive. They also have some peer support too. So those are people who are in recovery from mental illness. I think to be a peer support specialist, you have to be at least 6 months, stable, I guess. I don't know what else to call it, but any more questions on this? This was a big one. And this is a lot to say. This is our SAM program, which stands for Stage-Wise Addiction Mental Health Management. We just call it SAM. And the SAM program is for people with co-occurring disorders. So you have to have a severe mental illness and a significant substance use problem to be in the SAM program. So people with mental illness, a lot of people with mental illness also suffer from substance abuse issues. And so that's what this program is about. So this program is also very intensive. It's kind of like DBT in a way, and they actually do have a DBT that is, it's a version that is geared towards people with substance use and co-occurring disorders. It's called the Clear Mind Path. So you have to be in the SAM program for a little while to get enrolled into the Clear Mind Path, but it applies DBT skills to substance use, which is pretty cool. This team meets again once a week with a therapist, once a week with a group. There's some peer support, and again, there's some case management with this group too. But again, you must have a severe mental illness and significant substance use issues. So most of these people are not like your average pot smokers or whatever. We're talking meth or opioids or things like that. Alcohol, of course. Any questions on SAM? Okay. Navigate, this is a program, I think this is about 5 years old. It's a grant funded program, and this is for people with first break psychotic disorders. So you have to be under 25, I believe is the criteria for Navigate program. And it must be a new diagnosis. So these are folks that, you know, we get the young people that might get hospitalized and never had any issues, and all of a sudden they're delusional or they're hallucinating or they're having like a schizophrenia diagnosis. So it has to be a schizophrenic or a psychotic disorder. So it doesn't work for sometimes bipolar disorder. I know that I got caught on that one. Sometimes bipolar disorder will have some psychotic features, depression will have psychotic features, but it must be a specific psychotic disorder, which would be a schizophrenic disorder. This one provides support to the family as well. So if you've got a young person, parents, so they can learn how to manage that with their kids or loved ones that are having a psychotic break. And they also include an employment specialist and therapy. And like I said, this is a grant funded program. So there's a researcher involved, and they're like, and you have a specific psychiatrist dedicated to this team that works with ISK. Any questions on Navigate? And then case management. So we have case management for adults, youth, and folks with IDDA diagnosis. And so these people require a little bit more coordination of care. Go ahead.
Can you tell us what IDDA is?
IDDA is intellectually developmentally disabled adults.
Thank you.
And then DDA is what they refer to, or DD is for kids. So they keep an eye on people. They meet with them sometimes once a week, sometimes every couple weeks, and they help to keep them in the community and provide the support to get to appointments. They coordinate their care for them. And like if somebody is in need of housing, somebody is in need of not showing up for their psychiatric appointments, they help with gosh, what do I call it? Compliance and treatment and things like that. So when it comes to case management, let me back up a little bit. So my team also, if somebody comes out, say somebody gets hospitalized and they come out of the hospital on what's called a treatment order, an alternative treatment order. My team, emergency mental health with ISK, monitors those treatment orders. So that would be somebody who is determined to probably not be compliant with treatment, and they've done something like attempted suicide, or they have a psychotic disorder and they're not able to function without medication. And it's determined that they're going to become a danger to themselves or others in the future if they're not compliant with treatment. Then they would come out of the hospital on a treatment order. And I can get into the treatment orders a little bit and explain that at the end. I didn't include that, but I think it's important. But anyways, my team or ISK is responsible to monitor treatment orders in Kalamazoo. So if somebody comes out of the hospital on a treatment order, we usually assign them to a case manager, so that case manager can follow them and make sure that they're doing what they need to do and make sure that they're stable and safe.
Can you explain what a treatment order is?
I'm going to get into that at the end,
Okay.
because this is the last slide. So the highest level of care we have is the Assertive Community Treatment Team, our ACT team. So this is a specific form of treatment for people with very severe mental illnesses that require like a lot of attention. Or a lot of attention to maintain stability in the community. And so it's a mandated program. All community mental health in I think the state, I don't know if it's countrywide or federal oversight actually, are required to have an ACT team. We have 2 ACT teams. Each team has 8 people. So those teams go out in the community. Like if we've got some unhoused folks that are not participating in treatment and they need to have some monitoring, or just people who are chronically being hospitalized for whatever reason and just they need like a lot of support, they will go out into the community, and they actually have a nursing staff. So if somebody is on like an injectable medication or something, the nursing staff will go and they will meet them in the community and give them their shot, or they'll administer medication. Oftentimes the ACT team will see people every single day, except on weekends, but they are on call 24 hours a day. In case somebody shows up at a hospital, they can go to the hospital and meet with their people, or in the community.
What's the requirement to be on a CAP team? What are the?
Most of these folks are like 3 psychiatric hospitalizations within a 6-month period, severe mental illness, history of non-compliance with treatment, things like that.
What about the team itself, the caregivers?
Mm-hmm.
What are their
Well, to work with, well, let me tell you the qualifications to be a clinician with ISK. You have to be to be a therapist, you must be a master level clinician or higher. And to work on my team, you have to be a master level clinician or higher. And the ACT team and the case management teams primarily have master level clinicians, but they will take bachelor level folks who have a degree in a social services degree. So there are some bachelor level social workers. You might even have some people with sociology degrees that are meeting with these folks, but they're supervised by a master level or higher.
That team also used to, and I don't know if it's still true, work with people who had a DD and mental health diagnosis because they were so difficult to treat as just one or the other.
Yeah, so I don't believe that they have many. They may have some, but it's not very common. Usually those folks are referred to case management through our IDDA program. with ISK but the ag team, I think that there are some, but I'm
Yeah,
not sure.
we've heard From
many.
those case managers.
I observed that there's a new behavioral hospital that Bronson put up on
Mhm.
9th Avenue.
That
So
is
what would
actually,
that be?
so that hospital is actually a neurobehavioral hospital. They're a hospital chain that's out of Indiana. And it's not Bronson, it's next to
So
Bronson.
it says Bronson on the Bronson Health Hospital. Bronson Behavioral Health Hospital.
Oh,
It's new, it's on 9th Street. They're just finishing.
next to the athletic club?
Yeah, on the opposite side of the athletic club.
Yeah.
Towards Texas Township, going towards KBCC.
Okay. It could be their branding, because that one and the Bronson Behavioral Health Hospital in Battle Creek is operated by Stonecrest, which is an organization out of Detroit. So it could be that they've branded the one on 9th Street as a Bronson Behavioral Health Hospital, but it's okay. Yeah.
I
So
thought it was assisted living as it was going on.
no, it's a psych hospital.
So
It's a psychiatric hospital. So it's not connected with us, but
Okay.
But I can talk a little bit about, let me talk a little bit about treatment orders, and then I'll tell you a little bit about what the emergency mental health team does outside of this. So this is things that you can do that basic services, or the services that you can get if you come into our building. And my team, like I said, are all master level clinicians. So they will do what's called a biopsychosocial assessment. They'll ask you a bunch of questions, and then they will determine. So you can't walk in and say, I want to be on an ag team. You know, we meet and kind of figure those things out. So the emergency mental health team. So this is the team that I started on about 11, actually it's coming up on 12 years ago. And we used to just do emergency mental health, that team. So that team, we would go out and we would go to hospitals and we would screen people who showed up in an ER that were suicidal or having significant psychosis and not able to remain in the community. We would go out and we would screen those people. That's strictly what our job was. We still do that, but we also do this piece too, the assessment for services. We used to have it used to be separated, where there was an access department and an emergency mental health department. So what would happen when somebody comes into the access department to say, okay, I want to get these services in the middle of an assessment, then the person says, oh, by the way, I'm suicidal. Then they would call the emergency mental health department, and then we would come out, meet with them, and try problem solve around that. So I think it's been 2 years now where they merged those departments. So they said, okay, emergency mental health is now going to take over access. So when I first started, there were 3 of us. And then the 3 of us during the day, and then there was an evening shift person that worked overnight. So the emergency mental health team works 24 hours a day. Now we have 12, because we're doing this as well. So we determined 2 years ago that why have it separate, because now we need to bring somebody else in if something else is happening. So we're all skilled in the crisis de-escalation and determining suicide risk and things like that. So we will also go out with the police. If the police want us, we won't go to people's homes unaccompanied by police. But if the police call us and say, hey, we've got this person in the community, can somebody ride along with us or meet us out at the house, we will do that. I've been out to people's houses to try to figure things out. Like if the police can't find a reason to bring the person into the hospital, they ask somebody from my team to come out with some clinical expertise and maybe lay eyes on these people and say, okay, here's a reason that we can petition somebody to the hospital. So I think this is a good way to segue into petitions. So that's what we do, though. We're a mobile team. We go to the hospitals, we go out with the police, we'll go to the clinics, we go to Family Health Center, we go to the Gospel Mission, we go to Ministry with Community, and we will meet people in what's called, and we go to the YWCA. We'll meet somebody in what we refer to as a safe environment. So we won't, like a place that might have security or other people there, but like I said, we won't go to somebody's home for obvious reasons. So we also do all of the petitions for mental health in Kalamazoo. The probate court wants those to come through us. So this is where I'll talk about treatment orders and things like that. So if anybody in the community, anybody can petition anybody to hospital. But there needs to be certain criteria that happens. They have to typically be a danger to themselves or others. That's kind of that's the bar. So they have to be making like specific suicidal threats or specific homicidal threats, or doing things that are just like they're going to hurt themselves if they don't get help. So you come down, probate court requests that people come down to do the petitions through us, and you can do that at the urgent care. You come in, I would say typically between 8 and 3, because judges like to go home before 5. And we'll talk it through and see if it's appropriate for a petition, because you are taking away a person's rights when you petition them to hospital. So we'll help fill out the documentation, and then from there we send it over to the probate court. The judge reviews it and determines if it meets criteria for a pickup. If so, then the petitioner will go to the court, pick it up, deliver it to the police, and then the police will go and bring the person to the hospital for an evaluation.
So what's the difference between doing all of this logistical stuff versus calling 911? Like when should we go through this path versus somebody talking about self-harm?
I would say 911 is they are about to kill themselves. Like, they're like an immediate danger, and you can call the police at any time and say, hey, I just talked to my friend and they are saying they're gonna kill themselves, and the police will go out and do a welfare check. You can call, you don't have to call 911 for that. You can, and they'll direct it accordingly, but they'll do that. If somebody is like actively like doing something to hurt themselves, I would definitely call 911. Go ahead.
What's the relationship between your program and Griffin Place, or a suicide hotline?
Well, after hours, Griffin Place calls, our calls, like if you call ISK, the 373-6000 number, which is our main number, those route to Griffin Place from 5 p.m. to 8 a.m. During the day, if somebody calls Griffin Place and Griffin Place maybe can't figure out a plan with the person, then they will actually contact us. We have a great relationship with Griffin Place.
So you haven't displaced them, or it's.
Not at all. No.
I think, to Lila's point, like 911 is a lot easier to remember than 37.
Yeah. Well, the suicide hotline, the number is 988. So if you call 988 will go to Griffin Place. There are other suicide resources. Yes.
Kalamazoo Police Department, they will not answer the phone.
Yeah, you want to call consolidated dispatch.
They will not have 20 years of dealing with, they will not answer the phone.
Yeah.
911.
Yeah. Well, if you call it, or you can call the consolidated dispatch does all the calls. So yeah. Where was I? I was on petitions. Okay, so if somebody gets petitioned to the hospital and say the judge says, yes, this is a good petition, I'm going to issue a pickup order, you bring it to the police go out to this person's home. It's not like a warrant. So if the person doesn't open the door, they cannot go in. Maybe I should back up again a little bit, because in reference to your 911 versus a petition, if somebody is making like, I wish I was dead, passive suicidal threats, things like that, but you're really concerned about them, that would be a time to do a petition. Make sense? All right. So presuming the police bring somebody to the hospital on a petition, the hospital is going to evaluate them. So the petition doesn't guarantee they're going to get hospitalized. It means that they're going to be seen by a social worker at the hospital, which I think all the hospitals now have master level clinicians that meet with people and do like some sort of crisis assessment, and a physician. So they'll definitely will meet with a physician. At that point, the person could say, no, I didn't say any of that. And they typically have to go on what they see. So oftentimes those folks get discharged back home.
Well, this petition is this more about someone who isn't actively seeking assistance on their own,
Right.
then you're intervening.
right, yeah,
So anyone.
that's another criteria for
suicide,
petition.
Just call Griffin Place and
Mhm.
talk to somebody or.
Right.
knock on your door, what, yeah.
Yeah, this is more for like if it's like a loved one or a friend or something like that, and they're saying, I really feel like I'm depressed and I want to hurt myself. And you say, hey, Joe, let's go to the hospital. And they say, no, I'm not going to the hospital. They have to be refusing treatment. So what happens if somebody goes to the hospital on a petition and ends up getting hospitalized involuntarily? So once they go to the hospital and they say, I'm not willing to go in, I know the police brought me here, blah, blah, blah. The doctor can do what's called a clinical certificate, and that will order them to the hospital. Sometimes people think, refer to that as a 72-hour hold. But that will get them involuntarily hospitalized. They refer to it as a 72-hour hold because they can only hold somebody for 72 hours without giving them a hearing. So if you are involuntarily hospitalized and you get to the point where you have the hearing and it's ordered that you have treatment, what's Paula writing back there?
Keep going.
You brought your own job coach, huh?
Yeah, then you might come out on a treatment order, and that would mean that you're mandated to participate in treatment as dictated or recommended by Integrated Services of Kalamazoo for a minimum of 6 months. At 6 months, you meet with a psychiatrist, one of our psychiatrists, who determines if you need to be on a continued order, and then that can go on indefinitely. And those are the people who are on these indefinite continued orders are often the ones that are on the ACT teams.
All right, one more interruption.
Go ahead.
How does dementia fit in? Like, there's a lot of behaviors associated with dementia.
Uh-huh.
And I think even probably some diagnoses that dementia might.
Dementia is an interesting one because dementia is considered to be a medical disorder. However, in the cases, there's a diagnosis called dementia with behavioral disturbances. So if you get to the behavioral disturbances, then it becomes a mental health disorder.
Interesting, thank you.
Yep. She's putting up suicide resources. Okay.
These are services that are in the Kalamazoo area.
Mhm.
Are most other cities have similar services?
Yes. Like I said, there are community mental health in every single county in Michigan. And I think in the United States, actually, it has to have a community mental health. And I believe, like I said, with the ACT team specifically, they must have an ACT team, but most of these services are offered through other, like Van Buren and Berry County. All of them have community mental health. And the same situation works with petitions. I think that their probate courts want you to go through the community mental health as well.
A really specific question. If there's a minor that wants mental health care, but their parents don't want them to have mental health care, can they come on their own as a minor? Or do you
We
need
ran
to-
into that recently. Like I said, I don't work with the youth department, but there are specific rules as far as mental health treatment that goes for youth. Therapy, I don't think you can't get medication if you're a youth, but you can get therapy. Paula might be able to help me with this. It's 12 sessions, right?
Yeah, 12 sessions, in 1 year cycle. They have to be 14 or older. So if they're like 12 or 13, you can't, but 14 or older, you can for limited sessions. And the goal really is to help that young person learn some skills to talk to their parent, to get the parent, right? To be able to build that relationship so they can get the treatment a longer duration.
Is that a thing the kid would have to pay for? What is that?
That's a great question. So I'm gonna say it depends. There are some clinicians that will do like a non-billable session with that, I almost said student because I work in the schools. There are other people that will ask for insurance, and so that does get billed to insurance, which the parents will then see, right, that when they get their statements of this is what's been charged,
an EOB that they call it, an explanation of benefits, then they'll see that way, so it depends.
What if they're on Medicare or Medicaid?
A child?
Yeah.
They would see that, through their Medicaid if they look, yeah. Mhm.
And I appreciate everything that we've learned today, and I'm concerned that other people don't know.
Oh, trust me, they know.
About how does the rest of the community, how do people in the community know about these services? Or if
So when we, the hospitals definitely know. And most doctor offices know, but when they opened the urgent care, so the urgent care, opened on July 10th of last year. So when they did that, they met with many people in the community. So we met with law enforcement. In fact, that's another thing that we do, by the way. We have a special phone number, so if the police find somebody in the community that they think might need mental health treatment and that person is voluntarily willing to get mental health treatment, the police will call us and say, hey, I have so-and-so here. And if they are not, like high on methamphetamine or something, we have a bay that they can bring them in the back. If they're in crisis, they run into somebody in crisis. So, but we did a lot of PR with doctors' offices, hospital, police, and other community organizations. So people know. Yeah.
And then, so I would imagine that while somebody could walk in, like off the street because they feel they're in a crisis,
Mhm.
that's probably not the majority of those things.
No, the majority of the people that we're seeing are people that want services, and
They're probably from somewhere else.
yeah. Yep. Or they've Googled us or something. We have gotten so many, when we first started doing this, before we became a certified community behavioral health clinic and could take commercial insurance, we rarely got anybody with like Blue Cross Blue Shield or something like that. And then all of a sudden, like the day after we got the certification, we were flooded with people with commercial insurance. So somebody's telling somebody. And we're doing anywhere between 200 and 250 assessments for services a month. Yeah.
Is hoarding an eligible diagnosis?
Yeah. Yeah, you could see a therapist for hoarding. So yeah, we've been very busy. People have been finding us. Yeah. And they just started doing the youth assessments on a walk-in basis about 2 or 3 months ago. Those had to be by phone. Go ahead.
So do you feel you have enough personnel to meet the community needs? And if not, what can make get to that level?
It has been very difficult to find help, especially in the wake of COVID. For master level clinicians, even we've had a hard time filling seats on my team, and my team is like probably the most popular team to be on in the agency. I'm not just saying that because I supervise that team, but I think the difficulty happened with COVID because a lot of folks started with master level clinicians started doing therapy, and they were able to do teletherapy, and they're able to sit in their homes and do therapy with people and not have to go anywhere. So it has been difficult. And we have noticed that our doctors and prescribers are booking up or filling up fast. I mean, we're about a month out, but and when we used to be about 2 weeks out, because we're taking these commercial plans. So that's kind of a point of contention in some cases, but we're working on it.
You have the ability to take volunteers for, not going out, but paperwork, that kind of stuff.
I don't think so.
No.
I don't know. I think it has to do with,
HIPAA?
yeah. Yep. So, but even if you have to wait a month to get in to see a psychiatrist with commercial insurance, typically before we opened up our place, it would take 6 months to get in to see somebody at like Pine Rest or something. So, I mean, yeah. Just got a few more minutes. Any more questions?
I have a lot of times, I call it medication. Bipolar, a lot of, real common, I know psychiatrists, but they get feeling good and then they go off their medication.
Mm-hmm.
And they lock themselves in their apartment or they go to syrup, or pull a knife out, whatever. But it's really common that the state of Michigan just gives them medication and sends them out on the street, even downtown city of Kalamazoo, it's just,
Mm-hmm. Yeah,
there's no recourse until we don't harm, then the police show up.
right. Or until they get on a treatment order and they have to be on medication.
You have to go show up.
Yeah.
It's real common down there. So they rely on self-medication, like you mentioned,
Mm-hmm.
alcohol or drugs.
Yep.
Which is the normal procedure.
Yeah.
I've had them go off medication, alcohol, threaten to shoot me with a shotgun. For one particular, scared that I figured he had a shotgun, he would have taken to the pawn shop and bought more alcohol.
Yeah. You're probably right.
Adults with guardians, do they need this order? Or do they already have the power to put someone in the hospital?
Guardianship, you cannot put somebody in the hospital based on your guardianship. They have to have, like, we've had guardians petition people.
Go ahead.
Yeah. Oh, that is one thing that I should mention. If somebody has a guardian, like if you know somebody that has a guardian that wants to come in and get services, that guardian has to come in and fill out the paperwork to begin with to get services started for them, like consents for treatment and release of information and things like that. And also that reminds me, you cannot petition a minor.
As a guardian.
As any, yeah. Yeah, like if you have a child that's refusing to go to hospital, that's in danger to themselves or others, you cannot petition them.
Is there anything you can do, like if you know someone's doing self-harm or something like that, if they refuse to go in?
For a kid,
Yeah.
I don't know that there's a whole lot you can do, aside from getting their parents involved.
Yeah,
It's a tricky one, and self-harm isn't even a petitionable thing, because if it's considered to be, I mean, there's two kinds of self-harm. So there's self-harm for the purpose of dying, and there's self-harm for the, we call it NSSIB, non-suicidal self-injurious behavior. So those are people who cut themselves intentionally or to relieve some sort of emotional pain, or there's a gain for that. But and often that bring me back around to borderline personality disorder. A lot of those folks have are appropriate for DBT. Learn different ways to cope.
Are you able to print a few of your key PowerPoint slides? A little bit hard to see, to read them.
Oh, sure. As a matter of fact,
Or make them somewhat available.
I do have, that reminded me, I have brochures. So I will leave these up here. So this is a list of services that we have. This is what you can get at the Access Center. And then this is more about the urgent care. So I'll leave these up here and let you all help yourselves. Any more questions?
You connected to small
Thank
business.
you, thank you.
Oh, there's one more
Colleges, so that, students are more aware,
Yeah, Western knows about us. Yeah, we have got quite a few students from WMU and actually from KBCC.
Well, I know a lot of colleges, just because I've been doing a lot of visits, have their own mental health setup where you can go get like therapy
Yes.
for free.
Yep. Yeah, Western does have its own therapy. They're limited, but yeah.
Thanks,
All right.
Thank you.
Thank you. If anybody wants a copy of this PowerPoint, maybe I could have you write down your email on something.
Like a night post.
Oh, yeah, I could do that. Yep.